Hello everyone, I am Dr. Srinath, consultant neurosurgeon at Renova Hospital, Kompally. Today I am coming in front of you to talk about the topic of the head injury. Head injury is one of the very common injuries we encounter in daily life. Many of us have had a head injury in the form of a minor bump or fall in our lives at some point of our time. So when we see any patient with a history of a head injury, the important things we should keep in mind and things which we should be concerned are as follows. Any person with a history of loss of consciousness after the head injury, or any history of vomiting after the head injury, or any history of weakness of limbs or any seizures after the head injury is considered to be a very important sign. So all such patients should be immediately taken towards the consultation with a neurosurgeon, and if needed, they have to be evaluated with studies. So in patients with the above complaints, we initially stabilize the patients with treatment for the symptoms and then follow it up with immediately with a radiological examination called the CT scan of the brain. In this CT scan of the brain, we usually see the condition of the brain itself, the coverings within of the brain, and the condition of the skull, where we can see the evidence of any fractures. The many types of injuries we encounter in this CT scan are fractures of the skull, which can be linear or undisplaced or without any major damage, or a compound comminuted depressed fractures, which include the bone becoming into many pieces and sometimes being driven into the brain also, where this has to be corrected. The next injuries we encountered are the different types of bleeds in the brain. We encounter mainly three types of bleeds in the brain: the extradural hematoma, the subdural hematoma, and the intraparenchymal hematoma. The other minor type of bleed will be the subarachnoid hematoma, which is usually many times encountered in non-traumatic condition. So when we come to the extradural hematoma, this hematoma occurs between the bone and the covering of the brain called the dura. This sometimes constitutes an emergency where the patient is apparently normal immediately after the head injury, and after a brief period of normalcy, again the patient tends to go into loss of consciousness with headache, vomitings or seizures. This period of normalcy is apparently called as a lucid interval, and in these extradural hematoma patients, this lucid interval sometimes is a very important diagnostic sign. And once we have the history of this head injury with a lucid interval, we immediately get the CT scan done and diagnose the extradural hematoma. The extradural hematoma is most commonly encountered because of the bleeding of a blood vessel in the dura called middle meningeal artery, and when this artery is broken, the blood collects between the dura mater and the bone of the skull, leading to a condition called the extradural hematoma. If the extradural hematoma is located in the temporal region of the brain, it becomes a surgical emergency, and the patient needs to be immediately undergoing emergency craniotomy and removal of the bleed and control of the bleed, followed by a near normal recovery. The next important type of head injury with bleed is the subdural hematoma. This is the most severe type of hematoma which we encounter in traumas. This indicates important injury to the brain parenchyma as well as because of the damage due to the pressure of the blood collecting below the dura mater of the brain and above the brain. So this becomes a surgical emergency, and the results of the surgery and recovery almost always depend upon the immediateness of the surgery and the severity of the brain injury. And the next important injury is the hematoma within the brain called the intraparenchymal hematoma, sometimes also called the contusion in the brain. These contusions mostly are very smaller in size, but when encountered in a large size, they tend to increase over a period of time and accumulate fluid around it, leading to edema and swelling within the brain, and therefore they become an emergency if there is evidence of edema or mass effect, or when these contusions swell and damage the normal part of the brain. So any of these hematomas requiring surgery is a major surgery, which includes evaluation with all the blood parameters, followed by the recovery in an ICU, where the immediate postoperative period is a very important duration, with critical care needed, and continuous monitoring of the condition of the patient, including the pulse, BP, respiratory pattern, and the temperature. Such patients who after recover gradually after this type of head injuries will need to have undergo a period of rehabilitation, including physical, mental, as well as occupational rehabilitation. Followed by the recovery, the patient needs to be on medication as advised by the neurosurgeon for a period of time, and therefore neurosurgeon follow-up after the head injury and treatment is also important. Thank you.